It's a painful condition that affects millions of people every year. Carpal tunnel syndrome can lead to pain, loss of grip strength, and even loss of sleep. Here to tell us more about carpal tunnel syndrome and what we can do about it is Dr. Shahrokh from Yousefi Chiropractic Clinics. Wow, that was quite a mouthful.
Yes.
But, so I'm sitting at my desk and I'm typing, and that numbness or tingling has all of a sudden become a sharp pain. Is it carpal tunnel syndrome, and how do I know?
It could be. In order for it to be diagnosed through carpal tunnel, you have to have three criteria. The symptoms you just described, the patient presenting with the symptoms, doing physical examination, findings that would concur, and there are some diagnostic tests that needs to be done in order for it. So the term is being thrown around loosely these days. Anybody goes with a hand pain or wrist pain to a doctor, they say you got carpal tunnel. And they give anti-inflammatories. In severe cases who's been stretched for a long period of time, they might give a local corticosteroid injections. And in worst cases and severe pain, they might even do surgery.
Well, you're right. They do throw around that term. Even people that might write a lot and say, I've got writer's cramp, think they have carpal tunnel syndrome. So it's really important that we distinguish the difference.
Yes.
So how is it that you know if someone has it? What is the carpal tunnel too?
Okay.
What is that?
Okay, I have learned a long time ago, in order to understand anything, you need to break down the term they use to describe it. A carpal comes from the Greek word carpus, which means the bones, the small bones in your wrist. You got 8 of them. They're condensed and they're in an archway formed. And there's a thick band of tendinous sheet that keeps it together. And through that confined area, you got your tendons that help you move your fingers. You got your blood vessels, and you got 2 major nerves passing by. So it's a lot of structures passing through that little confined area. Each one of us, because of the variation in our anatomy, the way we've developed, ladies more so than men, that's why ladies have it more, the symptoms are more likely to develop it than male, because of the anatomy also. Can stress that area depending on the work that we do, the kind of activities we do, the hobbies that we have. The most commonly seen cases are in group of people who do assembly line work. They might assemble computers, machineries, or they work in factories that they pack meat, poultry, stuff like that.
And that's because they're doing the same motion.
The same motion
constantly.
over and over and again. And some of them develop it, some of them don't. And it has to go back again to the anatomical differences. What happens, the true carpal tunnel is the compression of a median nerve. You have 2 major nerves passing through the wrist. One is median, which is on the side of your thumb, and the ulnar on the side of your pinky. And usually, not usually, always, if there is a problem with the median nerve compression, distribution of it includes your thumb, your index finger, your middle finger, and part of your 4th finger, and usually on the palmar side. And that's when initially the patient describes it as numbness, pins and needles, cramping that you just mentioned. And as it progresses, patient reports waking up middle of the night because of it, because at the night you feel the symptoms more so. We all sleep in a flexed position, and that compromises the area a little bit more.
So you said there's these 2 nerves, so does that mean people with carpal tunnel syndrome would have trouble feeling hot and cold in their hands maybe?
In severe cases they could. In severe cases they could. Now, usually what the initial treatment is to, first of all, anybody who has any symptoms similar to this should, again, like I said in the last episode, should keep a log of it. When do they feel the symptoms? How bad is it? Distribution pattern of it. What activities brings it on? What makes it worse? What makes it better? All that, and the duration of it, how long they've been feeling it, when they go see the doctor. And the doctor, first of all, takes the story down, and then there's some physical examination procedures, orthopedic tests they can do. The most common one is phalanx, which would put your hand in a prayer position, maintain the posture for about 30 to 45 seconds minimum, and see if that reproduces the symptoms. And also there's a reverse phalanx, which is the opposite of it.
Well, that's good.
Okay. So these are the most common tests, physical tests you can do. Now, if you want to go a step further, they can do a nerve conduction velocity, which measures at the rate the nerve impulses travel through this tunnel. And there's a criteria parameter that has to be within, and if it's diminished, there is a compression of the nerve roots.
So we've determined that, unfortunately, we have it. What can we do? What treatments are there?
First, you got to consult the patient on modifying their activities, if it's activity related. You got to teach them some conservative stretches to do, some physical therapy. They can take over-the-counter ibuprofens. They can take some anti-inflammatory medication to begin with. And then you have to look at the patient, what they're presenting and what they're appearing as, because there are some predisposing factors such as obesity, diabetes, hyperthyroidism or hypothyroidism, and a bunch of other factors that may predispose the patient. So you've got to also consult them on that aspect of it as well to control. It's not just one factor. You've got to address all different
And just lastly, now that, what if we don't have it yet, but we want to make sure that we don't get it? Any quick tips?
There are simple stretches you can do. First of all, we use I want to make it quick. Everything we do during the course of the day, from the minute we wake up, involves grasping things, picking up things. So we use our flexor muscles more than their extensor. Stretching them, stretching your wrist, extending it back, opening up this. The tunnel is right here, so you want to open up this area as much as possible. Stretching it, take frequent breaks.
Well, that's a great idea. We will be practicing that. Thanks so much for
joining
us.
You're quite welcome.
More coming up after the break.